The Back Pain Show with Dr. Martin is sponsored by Dr. Edward Martin.
Welcome to The Back Pain Show, heard every Saturday night at 8 p.m. here on 870 KRLA.
Hi, this is Dr. Edward Martin, and welcome to The Back Pain Show. We're here every Saturday night at 8 p.m. on KRLA, and we welcome all of your questions regarding back pain or neck pain. That's my specialty, anything related to the back or neck. And please call us with your questions. And I'll give out the number at KRLA in a minute here. What I want to do, I want to ask our audience a question. Why aren't people getting better from their back pain or neck pain? I have people coming into my Woodland Hills office all the time, and some of them have been at it for 10 years or 20 years. Some have seen over 10 doctors, and they're still suffering from back pain and neck pain, and they're taking pills and injections, and they're going for years and years of therapy. What's going on here? If I had a broken arm or a broken leg, I would go to an orthopedic specialist. I'd be better in a few months. So why are these people still suffering? Call us with your questions. If you've been suffering for a few months or a few years, give us a call. Let me know what you've tried, and I have some very good insights on this. And call us at KRLA. The number here is 1-866-870-5752. That's 1-866-870-5752. And for the first 5 callers tonight, if you're going to call and ask any question about back pain or neck pain, my office in Woodland Hills will be giving out a free massage with our masseuse for the first 5 callers tonight. All right, so let me give out that number before I take another call. The number is 1-866-870-5752. All right, let's take the first caller. Hi, this is Dr. Martin. Who's this?
Dr. Martin, this is Steve.
Steve, and what kind of problem are you having?
Herniated disc for sure.
Okay, is this in your low back?
Yes, I'm a little confused about what kind of doctor to use for my herniated disc. My sister and my uncle are both medical doctors, and they want me to go for epidural injections and surgery.
Okay, and how long have you been suffering from this condition?
Oh, boy, 7 years.
7 years. Okay, and what have you tried? Have you gone for therapy? Have you been taking pain medications?
All the above, yes.
Okay, and what do you get? Do you get any relief out of that?
Slight relief for an immediate time after, and then the pain shoots right back.
Okay, so now they want to step it up a little bit. They want to go to epidural injections, and they want to do surgery. Is that what they're basically saying?
Yeah, and the injections are they're costly. They've really put me in the poorhouse, and they're just, it's a strain, and it really is a temporary fix for a very short amount of time.
See, that's the problem. A lot of people don't know, and many times doctors don't discuss this with the patient. They don't tell them an epidural on the average maybe lasts anywhere from 5 minutes to a month or so. And I'd say if I averaged them all out together, probably 2 or 3 weeks. And it's very dangerous. They make you sign a big release saying that you could get permanent nerve damage, you could get paralysis. Believe me, you should see the release form before you even go for a shot. Have you signed any of those?
Yes, I have.
Yeah, so you know what I'm talking about. And tonight we're going to be covering spinal decompression therapy, which in my mind is the state-of-the-art treatment for back and neck conditions. I rarely these days have someone stay in my office even over 3 months. So when patients are just getting pain management all the time, and that includes anything from pills, epidural injections, therapy, I mean, they're just basically playing with the symptoms, and then they're going to have this problem years later. So what are you telling, so your relatives are medical doctors, what are you telling them?
Well, I'm telling them that it's not working. The pain is getting worse. The pain is constant. I'm in bed all the time. I really can't leave the house. And they're continuing to push me on this. And these are relatives.
Right, because that's what their training was. That's the routine they learned. And certain routines in medicine are very effective. If I have a broken arm, I expect that doctor to know how to fix it within a few months. I don't want to ask them, you've been at it how many years? Was it 7 years?
Yes.
Can you imagine, what if I had a broken arm for 7 years and I'm still letting the doctor just massage my arm and throw pills in my mouth? I don't think I'd accept that, would you?
No, and I'm worried about these pills because, I'm doing my own research on the computer, and I'm reading about problems with the liver and the kidney, and, I think you can maybe tell me a little bit more about that. I mean, that's a problem too, right?
Well, that's the problem. See, I don't believe a patient should be on pain medications for an extended length of time. I don't care if they're on it for a month or two, but when people come in and they still have the same problem, whether it's a herniated disc, sciatica, spinal stenosis, or a number of other back or neck conditions, and if the doctor has no clinical expectations, I feel a doctor should have clinical expectations for what he's treating. Or he should be honest with you. He should just say, I have no idea when you're going to get better. We might be at this 50 years from now with you. But they're not going to be that blunt about it, right? Your relatives are medical doctors. Have they told you if you go for these treatments, epidurals and surgery, did they say when you're going to be better?
No.
Guess what? There's no guarantee in that. Matter of fact, back surgeries have a very high failure rate. So these days, now that we're using spinal decompression therapy, which I'll get into in a few minutes, it's very specialized equipment for treating conditions like this. And I send maybe 1 or 2 people a year to surgery. But it's only because the equipment we're using is so superior. We're not just playing with your symptoms. So, like I say, if I had any condition, a broken arm, pneumonia, whatever, I'm going to ask that doctor, okay, if I do your treatment regimen, if I take your pills, when am I going to get better? Am I going to let him mess with me for years if I have pneumonia? No, I'll be dead. So you've got to put your foot down, and even if they're your relatives, and say, okay, tell me what I can expect. How is this going to fix it? Tell me the logic behind it. Besides covering up the symptoms for a temporary period, which might be only 5 minutes to a few weeks, how is he going to fix it? And then if he sends you to surgery later, how's that going to do? Now, notice no one comes into my office with a broken arm and they don't tell me, hey, my arm's broken for 10 years. Those doctors would get sued if they did that. And patients won't put up with that. So in my office, I do see people with back pain and neck pain telling me they've been at it for 2 years, 10 years, 15 years. It just goes on and on. So call me at the office if you'd like a free consultation. I'm in Woodland Hills, California. The number is 818-314-2054. 818-314-2054. And we'll see you next week at 8 p.m. on KRLA on Saturday night.
You've been listening to The Back Pain Show, heard every Saturday night at 8 p.m. here on 870 KRLA.
The Back Pain Show with Dr. Martin was sponsored by Dr. Edward Martin.